I ship worldwide, but I don't have a manufacturer or distributor in Canada, so you can't go somewhere in Canada and buy them. But you can certainly purchase my supplements from Canada. It's probably the #1 country outside of the United States where people do purchase my supplements. So I'm not your doctor. I can't tell you if you safely can take something, but there is no derivative of nuts or fish in my multivitamin. And all of my supplements are free of the most common allergens like gluten, dairy, soy, corn, all that kind of stuff. So there are 2 supplements, I think, that have a derivative of dairy in them, and they're clearly marked on the website. Again, if we're talking about sensitivities to things where it's just, you don't do well with it, you have some mild reaction to it, that's different. If you're having a, like anaphylactic reaction to things and you're very sensitive, then I would certainly, just double check with your physician before starting anything new. If you're starting things new, making sure you're in a safe place, you have an EpiPen, you're around a physician, that type of thing. In general, I cannot speak to your personal health issue. If someone has a reaction to a supplement, you can return it. We have a 30-day money-back guarantee. We deal with a lot of people who are sensitive. They have reactions to things. So, if you try something and you react to it, you can return it. Now, again, if you are in a situation where you're having anaphylactic true allergy symptoms, you would want to consult with your physician before trying anything new. We used to, and it just wasn't selling very well, so we no longer carry it. We have the fish oils in the capsule. They go down really easily, so, and no fishy aftertaste whatsoever. So we have a Candida kit. It is comprised of our caprylic acid and our Candifence. So I believe we actually are on back order for either the Candifence or the caprylic acid, so you might not see the kit up on the website right now. Basically, we had a big sale a little while ago and it wiped us out of everything and we couldn't keep up with it. So everything's in the process of being made now and we're getting a lot of things back in stock in June. Generally speaking, yes, glutathione is naturally made in our body. It's our biggest detoxifier. There are no downsides that I'm aware of with glutathione other than maybe some magnesium wasting, and so adding in some magnesium with your glutathione. I don't know specifically what you're referring to. So in general, it also depends, like I was mentioning about that folic acid. So there's some studies showing high dose folic acid has been a promoter of colon cancer, whereas folinic acid has not. So I think it also depends on when you say a B vitamin, in what form is it in, which B vitamin, are you getting synthetic? Are you getting naturally derived? All of ours are naturally derived. They're not synthetic. Then you really have to take into account everybody is not an individual. If somebody didn't have any mutations at MTHFR and they were taking my methylation support versus somebody like myself who has 2 mutations, so I'm able to effectively use about 10% of what I put into my body. So someone who has 2 mutations like I do really cannot effectively use the B vitamins that they're intaking, and they have to be in the premethylated form. So it's a much more complex issue than that. For the most part, which of course nobody wants to have expensive urine, but for the most part, B vitamins are excreted in your urine if you do not need them or if you take too much. And then of course, certainly you could read about signs and symptoms if you're having any issues. I've worked with thousands of people in my clinic and I've never had anybody have symptoms of taking too high dose of a B vitamin. But certainly something, if you're worried about it, concerned about it, check with your physician and make sure you're being monitored by a physician. Again, I can't speak to your personal health condition, Tina, but in general, I've formulated the multivitamin to be very complete. So, unless you're somebody like myself who has 2 mutations at MTHFR, for the average person, the B vitamins in there are sufficient and even optimal for someone to just take the multivitamin. I address this in my book, The Thyroid Connection. And in general, most of us are iodine deficient because we're no longer eating iodine the way that we used to eat iodine. And then we have been bombarded with the other halides, fluoride, chloride, and chloride, and bromide. And so they're ubiquitous in our environment now. So it's creating an effective iodine deficiency. And then when you add the fact that we're already iodine deficient, it's sort of like double whammy. So the amount that I have in my multi is really repleting what we normally would have gotten in our diet. Again, in my clinic, working with thousands of people with Graves and Hashimoto's, I haven't had people reacting to that amount of iodine. Now, certainly you want to consult your physician and work with them and make sure that that's okay for you and that you're not having any side effect, but it's really a very, very small dose. A lot of people who advocate iodine for people with Graves or Hashimoto's are advocating 25 milligrams or 50 milligrams. I have 300 micrograms, so you can see thousands fold less. So it's really the amount that you would naturally be getting in your diet. It's like a 1-2 punch. So glutathione is the biggest detoxifier in our body, so it's helping your liver pull it out of the body. And then the charcoal is there to bind the toxin and then help you, poop it out essentially. So glutathione pulls it out and coconut charcoal binds it. Certainly, it is rare to get too much magnesium, but it is certainly possible. And this sounds like perhaps you were at least sensitive, or perhaps you have really good magnesium stores and you're doing better at the lower dose. So it sounds like taking 100 milligrams for you is potentially the proper dose for you. Are you referring to yourself or someone having a C-section, or are you referring to being born by a C-section? So if it's being born by a C-section, as the baby goes through the birth canal and then the vaginal canal, that's when the baby takes a big gulp in and gets inoculated with all the good bacteria. In fact, it's thought that the gut is sterile until that happens. So if the baby doesn't go through the vaginal canal or the birth canal, then that big gulp of bacteria never happens if they come out as a C-section. So they never really get inoculated with all that good bacteria. So there's studies showing that babies born by C-section have a higher incidence of allergies, eczema, even potentially autoimmunity. So there is a process called seeding, which some people are doing, and I wrote an article about that. There's a process about seeding where they take a gauze and put it in the mother's vaginal canal and then wipe the baby down afterwards. And that's shown to be nearly as effective as the baby going through the birth canal in terms of microbiome and minimizing allergies and eczema and even potentially autoimmunity. That's really, I don't know that there's any particular right one, although actually one of my patients was telling me the other day they'd been on a website that had some probiotics specifically for histamine intolerance and mast cell, but they didn't, I asked them to send me over the info so I could know, and I haven't gotten it yet. So I think it's really whichever one works for you. So you, can try a lactobacillus-based one, or could try a a soil-based organism one like our Primal Earth. So it really depends on your sensitivity, Mamiya. I mean, I can't tell you. I don't even know that the soy or the corn is affecting your gut. Now, if you're kind of getting those at a Starbucks and it's not organic and you're getting GMOs, I would at least, if you seem to feel like you can tolerate corn and soy, and the only recommendation that I would say if you're not seeing any ill effects from that is to at least try to get organic if you can possibly do that, because the other is most likely GMO, and that has an impact on your gut. So Kristen, if you're using my GI Repair Powder, that has 3 grams of L-glutamine in it. So you do not need to take the additional L-glutamine, or I can't speak to you personally, but I mean, they're sort of redundant. So unless maybe you're traveling and you just want the ease of pills when you travel and you don't want to take a powder, it might be nice to have the pills just for those circumstances, or you forget it in the morning and you want to have a bottle of the pills at your office so that you can, do that at the office, but there is sufficient GI repair powder to help repair the gut, sufficient L-glutamine in the GI repair powder to help one heal their gut. I talk about that in the autoimmune solution. The main thing is following, a program like the autoimmune solution, where you're really looking to support the entire immune system, which will help you to fight off the Epstein-Barr. Things that I use in my clinic are the immune booster. We used to have something called humic acid, and also you can use monolaurin or lauricidin. I don't sell that, but that's been helpful for many patients that I've seen for like Epstein-Barr, herpes, things like that. My website has great videos. It has great information about, exactly how to use, not every, well, it does have information on how to use every supplement. Most of them have a video as well. Generally speaking, I can't speak to you personally. Generally speaking, if you're dealing with leaky gut, between 2 grams to 4 grams a day, and typically you can either do it on an empty stomach. Some studies say empty stomach, other studies say it doesn't matter. I'm whatever's convenient. If I do it, I use a powder and I put it in my smoothie. If I do pills, which I typically don't do of the L-glutamine, I swallow enough pills of other things. So if I have a powder of something, I take the powders typically and I put it all in my smoothie. So your regular lab can test for MTHFR. It can be expensive if your insurance doesn't cover it. So what we've been doing in my clinic is getting people to do a 23andMe, which I think costs like $199 or $299, versus the out-of-pay pocket in my clinic was like crazy. And I wasn't even marking it up. It was like $600 or something, $300. And when you get a 23andMe, then you get all these other SNPs. So the only way to test for MTHFR will be accurate. Either you have the mutation or you don't have the mutation. It's not really left up to interpretation. So any test that can test that should be testing it accurately. I think it's helpful for everybody to know, what their genetic SNPs are. So, I mean, I think it's helpful for everybody to do a 23andMe. Now, you've got to take it with a little bit of a grain of salt that this is all new information and nobody has all the answers to it. I mean, it's, if you have this, does it mean that? And we're learning more and more how all these genes interact with one another, how these SNPs interact with one another, but it's very helpful. I mean, as soon as I could get a swab from Elle, my daughter, I tested her for MTHFR when she was, I don't know, a month or 2 old. So I think it's very helpful information for anybody to have, particularly if you have autoimmunity. So that's something you can get your doctor to do and your insurance company to pay for, or 23andMe is a place that you can go and pay out of pocket. Typically not. So most people are, if they're allergic to coconut, it's the protein in the coconut meat. So the coconut charcoal is made from the charcoal from the shell, and it's cooked. So there's really not that protein that's found in the meat of the coconut in the coconut charcoal. And same thing with the caprylic acid, that we're extracting an acid from the coconut, not using the protein. So most people who are sensitive or allergic to coconut. Now, if you're anaphylaxis, again, I would consult with my physician before doing that. And if you were going to try it, be in a safe environment around a physician with an EpiPen. But we're dealing with 2 very different things. It's typically when most people are getting tested for allergies or sensitivities, it's the proteins in the coconut meat that they're sensitive to, not the acids and not the shell. I would definitely get with a functional medicine doctor, somebody perhaps who's really well versed, obviously in anxiety and neurotransmitters, but also potentially in, toxic mold. So anxiety is one of those things that can be a symptom just of toxic mold. So, I wish I could offer you more advice, just based on that little bit. And I'm sorry to hear that she's suffering with that. Let's see. So pure encapsulations, I don't know if they have one. Thorne is a good company. Pure Encapsulations is a good company. Designs for Health is a good company. So those are ones that I know that are supposed to sell to physicians, but I have seen them available other places. So you could check for that. In general, as I just mentioned at the beginning of this video, and if you didn't watch it, you could go back and check it out. I believe that everyone can benefit from a high quality multivitamin, fish oil, probiotic, and vitamin D. And we actually sell that in a kit called the Essentials, the Myers Way Essential Kit. So I think that'd be very helpful. If she's borderline anemic, you may want to have them check her, iron status with an actual iron panel, not just an H and H, hemoglobin and hematocrit, and get them to check a ferritin as well, because that will look at her iron status, and if she needs it, then potentially talking about an iron supplement as well.